I have some important news for all you parents out there today. We're on track to have a record high number of measles cases this year in the U.S. So in today's HealthCast, Local 10 medical specialist Dr. Ari Soffer looks at this resurgence and why we, right here in South Florida, could be at a greater risk than other parts of the country.
Like many viruses, measles is airborne. So when an infected person sneezes or coughs, the disease spreads.
Measles is highly contagious, meaning that if we have one case of measles, that person can potentially infect 12 to 18 people with just walking by their door. Those viruses can get out into the environment and can linger there for up to 2 hours.
So how can you prevent the disease? Get vaccinated. Adults who can't remember if they were vaccinated as a child should get the shot again. Infants 6 months through 11 months old should have 1 dose of measles vaccine and then another 2 rounds after their first birthday. But there lies another problem. Debate over childhood vaccines has impacted the number of children being inoculated.
We have seen a trend over the last 5 years where that's increasing.
Florida is one of 19 states which allows personal belief exemptions for school immunization requirements. In 2008, the health department noted 160 children received that exemption. Last year, that number was up to 490.
If you decide that that's not the right choice for you, and we do find a case in your school or in a congregate setting, we will have that person be quarantined for the incubation period.
If an unvaccinated child becomes sick with the measles, they'll be kept out of school for up to 21 days. That's a lot of missed time, difficult really to make up, not to mention the health risk of being infected. Since there's no scientific evidence that vaccines cause harm, I don't think that's a risk worth taking. With your second opinion, I'm Dr. Ari Soffer.
And while measles is usually a fever, a runny nose, a cough, and that full body rash that we see so often, doctors warn that 30% of cases do have complications, which can be anything from a simple ear infection to pneumonia, even death. And that's why health officials like Dr. Soffer want everyone to take those necessary precautions. Janine, Victor?
Christy, thanks so much.